We're about enabling and empowering people. Because at the end of the day, it's about our nurses.
They need to know that you really understand what they're going through on a day-to-day basis.
The impact of nursing well-being on our patient experience or patient quality is profound.
The healthier the nurse, the better care they can provide. Elemeno Health is driven to improve the confidence and well-being of emergency nurses as individuals, teams, and a networked community. The innovation surrounding this app is having an impact on efforts to support emergency nurses worldwide.
You care for the caregivers, they're going to provide better care for you.
Elemeno provides customized, clinical, bite-sized information.
Having information is empowering, and that's a lot of what Elemeno helps us to have for everyone that works in our emergency department.
Excellence in care requires teamwork.
With each new patient arrives a new set of diagnoses, a new set of care priorities.
There's a lot of procedures, a lot of policies, a lot of things going on all at once.
And it's not just physically demanding, but also mentally, because you're trying to keep people alive or progressing.
Let us work as a community. Let us learn from each other, delivering the best care for our patients, share that with each other, and allow us to modify it to fit our own unique resources, people, and needs.
It's what drives Elemeno, customized content in the moments frontline healthcare workers need it most.
And the emergency room nurses are the front lines of the front lines.
So what was the risk level, it'll ask you? We go through daily surges, and it's very anxiety producing for all of the staff and providers.
So when it gets super hectic like that, it can be easy to forget things, very important things.
And for me to go to the computer and look up a policy isn't that helpful.
So much is around high-risk issues that happen with very little frequency. It's about give me that bite-sized nugget in the moment that is contextual to what I'm doing right now.
So Elemeno to me is my 911 that I use when I'm not sure about something.
Situations that test the nursing community daily.
With so many traumatic events that we are a witness to, and the loss and the trauma to families, that does have an effect on our staff.
Talking with my other healthcare professionals about any challenges I have, that helps quite a bit so that I can not get burnt out.
Burnout happens after an accumulation of a bunch of these events. It leads to something called compassion fatigue, where you're not able to provide really good care to someone because you're in a crisis yourself.
So having people that helping hand has really assisted me in taking a step forward in this position.
As we've incorporated in Elemeno, it's about how we can each say thank you to each other. Whether it's nurse to nurses, doctor to nurses, nurse to tech, creating that culture of we're all here to help.
Connecting and enhancing the power of the nursing family.
All healthcare is ultimately local. We need to understand that the empowerment that's happening has to happen at the level of your family. Take care of that immediate community, then that community is ready to take care of the broader community.
And the broader community needs more emergency nurses.
What the data shows us is there's basically been a mass exodus from the field of nursing. So I do think, part of that is nurse wellness and expectations on the job.
So stepping up retention of experienced nurses and training talented newcomers is a must.
The value is monetary in the time it takes to get a competent nurse. An orientation for us, it can be upwards of 6 months. Elemeno had evidence to show us that the training time for ER naive nurses was shortened by using it.
Empowerment for the healthy emergency nurse of today and the future.
It's one thing to come to work, clock in, do your thing and go home. But if you are not whole and healthy, then that just doesn't work. Then it leads to absenteeism, to mistakes, and we don't need either one.
The future of the emergency nurse, it is about listening. It's about an easy pathway to tell leadership, this is what I need, and an easy pathway for leadership to close the loop and deliver on it.
And that's my big thing about nursing is I want to help the community that I grew up in.
So I think the future is bright. I'm excited when it comes to emergency nursing.
And you equip that nurse to be stronger and stronger, to build their resilience and to help fuel them so that they can deliver that best care possible to every patient.